Welcome to the Megan Claire Show. I'm a breast cancer survivor, patient advocate, and your host, Megan Claire Chase. I'm working with Ancora AI to help share their mission, which is to give unbiased and comprehensive information to patients to empower and bring vetted clinical trial options to all patients. Now, today's show, we will discuss a doctor's tips and tricks for patients who are on clinical trials or considering them. So I am so thrilled, and wait until you hear his accent, to introduce you to Dr. Moritz Schramm. Welcome.
Thanks, it's really nice to be here. Thank you so much, and thank you for the wonderful introduction.
So Moritz, and he told me I could call him that. I'm all excited. So Moritz, why don't you give us a little introduction of yourself and your background?
Yeah, of course. So my name is Moritz. I am a neurosurgery resident, or as we call it in the UK, a registrar. I work in the United Kingdom, and I've graduated from medical school in 2015 with a combined medical degree and a PhD, and started neurosurgical training in 2017, which is the sort of the normal progression pathway for people in the UK, where we do a sort of quite broad-based training before we start our specialist registry residencies. And that's what I've been doing for the last 4 years, except for the last 6 months when I've been looking after my daughter, which has been a really magical time. And I'm thrilled to be here. It's really nice to be here. It's really nice to speak to you, and I'm really excited about the mission that Ancora has been involved with. And I think it's a really, really powerful tool to help put power in the hands of patients. And I think that's one of the reasons why I'm excited to be here, because, you know, that's what it should all be about: make the information available to the patient and help them find out about trials that are right for them.
Absolutely. And, you know, with you saying that, like, I feel so empowered after, you know, partnering with Ancora, because I have learned so much about clinical trials. So let's get this started. How do clinicians learn about clinical trials, and why do some get involved?
Yeah, so you'll learn about them in medical school. They form the foundation of the really good evidence that we have. So some of the biggest advances in medicine are due to clinical trials, and particularly well-designed clinical trials have, you know, completely changed the face of medicine. They've done it very recently with things like the recovery trial for COVID, and, you know, more than I could possibly name, and more than I'm probably aware of. So they form this cornerstone of everything you learn about. And of course, you know, doctors on the whole being ambitious people, there are some who want to be involved with writing the next chapter of advances and you know, changing practice. I think there is no bigger impact you can leave on the face of healthcare, you know, beyond leaving impact on individual patients, than to change the practice of doctors worldwide. And I think that's why people are really keen to get involved. Having the chance to make better treatment for people, that's a hugely exciting part of medicine, and a huge privilege to be involved with.
Absolutely.